is National Skin Cancer and Melanoma Awareness Month, and today is Melanoma Monday, an opportunity to inform people about the symptoms and causes of the disease and how to prevent it.
So here with us now to talk more about melanoma awareness and prevention, we are so happy to have on the show Jocelyn Depathy. She is a clinical assistant professor of physician assistant studies at Quinnipiac University. Jocelyn, thank you for taking the time to join us. How are you today?
Good, thank you for having me.
Yeah, glad to have you here. Let's start with the broad brushstrokes here. Of course, there's all kinds of skin cancer. I think melanoma by far is the most sinister. Can you just explain what it is and why it's so important that people know the impacts it can have?
Absolutely. So there's various different types of skin cancer, but melanoma is probably the most deadly of the skin cancers that you can get. And in many cases, it's preventable by proper sun protection. So it's super important that everybody wear sunscreen and get screened by their dermatologist.
Now, what are some of the signs and symptoms that people should look out for?
Sure. So with melanoma, we think about the ABCDEs. So we look for moles that are asymmetrical, that have odd borders or borders that kind of fade into your skin and are not sharp and crisp. Any mole that's very dark in color or has different colors within that mole should definitely be looked at. And for diameter, D for diameter, we think about the size of a pencil eraser. Any mole that's bigger than that, you should definitely have checked by your dermatologist. And E is for evolution. So any moles body that are changing. So if they're getting bigger, if the colors are changing, they're itchy, they're bleeding, all of those should be definitely checked out by a physician.
Who is more likely to get melanoma?
So patients that have lighter skin definitely are more at risk, and anyone who has a prolonged history of sun exposure. So this starts in childhood, it's cumulative. Every time you're out in the sun counts, but certainly those who have had second-degree burns from sun or sun poisoning, that increases your risk as well.
Okay, now what are some of the best treatment options available out there?
The best for treatment of melanoma is to be seen by a physician, and really excision of that lesion is going to be the preferred treatment. If the cancer has spread, there's other options, including immunotherapy and less commonly chemotherapies, but excision and cutting out the mole is the first step.
Yeah, and I've spoken to a lot of dermatologists, and they say whether it's melanoma or some of the other types of skin cancers like the squamous cell carcinoma, that tends to be people's come-to-God moment when you start cutting things out of them. Of course, we want to try to minimize that and not have to do it. So I imagine screening then at some point is going to at least help minimize how deep you have to cut when you do have to cut, yes?
Absolutely. We always kind of use the adage, check your birthday suit on your birthday. So to see your dermatologist at least yearly, and then depending on the kind of moles you have, what they look like, they might want to see you at more frequent intervals, every 6 months, every 3 months, but at the minimum yearly is what we recommend.
All right, and before we head out, can you remind people that everyone needs to wear sunscreen?
Yes, please, everyone wear your sunscreen, UVA and UVB protection, reapply every 2 hours, and if you're going into the water more frequently than that.
Yeah.
All right.
Well, Jocelyn, thank you so much for taking the time to join us this morning, especially those ABCDEs. That's one good thing to keep in mind, so you can keep an eye on it yourself. We do appreciate it.